Hi, everybody. Welcome. So glad you're here with me today. I'm Leslyn with the Lipedema Project. I'm president of the board and director of research. I like to get together with you twice a month on the first and third Thursday to talk about research papers that have been written about lipedema or of relevance to lipedema. So that's what we get together and do twice a month here. If you're here with me live, be sure and post something in the comments. Let me know that you're here, maybe where in the world you are, maybe even what the weather is like, because it's that time of year that weather is changing. So it's like nice to hear what's happening around the world. I'd love to hear from you. And if you're watching this on the replay, I'm hoping that this is going to be good information for you and will be, of course, available for you to be able to go back and watch this anytime you want. So today, the paper that I wanted to talk to you about is called The Effect of a Low Carbohydrate Diet on Subcutaneous Adipose Tissue in Females with Lipedema. And there is a link below if you would like to get this. It is an open access article, so you should be able to get this complete paper for you to be able to read the whole thing if you'd like to. If you have any difficulty getting the paper, be sure and contact me. My email will also be posted down below, leslyn@lipedemaproject.org, and I can send you the paper. But again, it is open access, so you should be able to get this paper. So this paper just came out in November of 2024, and it is by a group in Norway. It's led by Julianne Lundanes and Siren Nimmo. And Siren actually presented at one of our past conferences with Lipedema Simplified. And they've done several studies about lipedema and carbohydrate restricted diets. So this was published in Clinical Nutrition ESPEN, and that stands for the European Society for Clinical Nutrition and Metabolism. So I'm assuming that this is the official journal for that organization. And so the aim of this was to do an analysis on the effect of two diets, low carbohydrate and low fat, on adipose tissue, subcutaneous adipose tissue in the calf of women who have lipedema. So remember that subcutaneous adipose tissue is where we have the lipedema fat, the fat that's affected by the condition of lipedema. And this paper was actually a secondary analysis of a study that was done by this same group. So they published this earlier this year, and I actually did one of these research updates on that study. That paper is called Effect of a Low Carbohydrate Diet on Pain and Quality of Life in Female Patients with Lipedema, a randomized controlled trial. So that's kind of like the highest level of study that you can do, is that randomized and controlled trial. So they took some participants out of that main study and then studied them to look at these various things that they wanted to specifically look at the adipose tissue in the calf of women with lipedema and what was the effect that these two different diets had on that fat tissue. But they also looked at other outcomes, and that included lean mass and the ratio between fat and lean mass in the participants, the calf circumference, and overall body weight and body composition. So these are data that they got also on all of the participants in the secondary analysis. And they did this. The data was collected prior to an 8-week diet intervention and then after the diet intervention concluded. So specifically, what the measurements and assessments that they did for this analysis was they had data on body composition using bioimpedance. So it's like a body composition scale. And then they also did an analysis of the calf composition. So of the subcutaneous adipose tissue and the muscle in the calf, and they did the circumference of the calf. And then this was done using MRI. Then they also used the brief pain inventory to assess the levels of pain before and after the diet intervention. And they also tested the compliance, how compliant was each diet group with their prescribed diet. And so they did that by weighing them, by using daily food records that they analyzed and discussed. They recorded any adverse effects or potential side effects that they may have experienced during the course of the study. And then they also measured ketones that were measured in the blood and also in the urine. So they had 13 participants in the secondary analysis. And so they had 5 in a low carb diet group and 8 in a low fat diet group. So a total of 13. Average age was 46 years old and average BMI was 37. So let's look at the diets themselves. And again, I reported on this when I did the main study, but just to refresh your memory, or if you weren't here when I went over that other study, that other paper. But it was 8 weeks, and both groups were told to keep their calories per day at 1,200 calories per day. This is called a low energy diet because it's low calorie. So both groups were having the same number of calories, but their diet was composed differently. So in the low carbohydrate group, they were having 75 grams of carbohydrate per day, or about 25% of their calories from carbohydrates. And that's different from the low fat diet group that had 180 grams of carbohydrate, or about 60% of their calories from carbohydrate. Protein, both groups were directed to be the same, to have 60 grams of protein per day, or about 20% of their calories. And then a low carb diet, because of the low carb, they were going to have higher fat. And so they were directed to have 73 grams of fat per day, or about 55% of their calories, versus the low fat diet group had 27 grams of fat, or about 20% of calories. So you can see how the diets were composed quite differently. All participants were told to have a multivitamin, to drink about 2 liters of water, and to abstain from alcohol. Those were instructions were the same for both groups. So let's look at the results. So first, let's look at adherence to the diet. And this was, of course, previously reported on, but both groups did adhere to that same calorie intake, about 1,200 calories per day. The low carb group, as we would expect, they had higher levels of ketones, because you generate ketones when you are keeping your carbohydrates low. And then the low carbohydrate group actually had a lower than directed carbohydrate intake. Remember, we said, go ahead and have 75 grams of carbohydrate a day. Well, they actually only averaged about 66 grams per day. And they actually ate more fat than was directed. They were told to have 73 grams of fat, and they ended up having just a little bit more, 76 grams of fat per day. And they actually had higher protein as well. Both groups were to have 60 grams of protein per day, and the low carb group had 73 grams of protein per day. And so all those were different compared to the low fat diet group. So looking at the MRI. So remember, the MRI, they were going to look at the subcutaneous fat and the circumference of the calf using MRI. And there was only a significant reduction in subcutaneous adipose tissue in the calf in the low carb group. The low fat group did not see that. In body weight, both groups had a reduction in body weight, but the low carb diet group had more. They had almost 10 kilograms over the 8 weeks versus 3.5 kilograms in the low fat diet group. And then with the measures for whole body fat mass, for free fatty fat mass, and intracellular and extracellular water and total body water, there was no great difference in each group. Now, both groups improved in all those, but there was pretty much the same between those two groups. And as far as pain, only the low carb diet group had a reduction in pain. So that was pretty interesting outcomes. But remember this, there was new information about that subcutaneous adipose tissue in the calf in this secondary analysis. And so the conclusions that the authors came up with is a low calorie, so a low energy or low calorie, low carbohydrate diet has a potential to reduce calf subcutaneous adipose tissue and circumference, as well as pain in women with lipedema. And remember that since they only assess the calf, but it is on the lower body, we may be able to generalize this to maybe all subcutaneous adipose tissue and fat that is lipedema fat. We might be able to generalize that information to all of that in the lower body. And so the potential mechanisms, they say, behind the ability to reduce that subcutaneous adipose tissue in women with lipedema using a low calorie, low carb diet should be explored using larger studies. This was a pretty small sample that they used in this one. So one thing I didn't tell you on their results, remember we had changes in both diet groups, and both diet groups lost lean mass. So they lost weight, and part of that weight was in lean mass. And I wonder if this is related to the low carb group stuck to that low calorie diet. And if we had allowed the low carb group to eat as much as they want, eat to satiation, then would they have lost lean mass? This seems to be a function of typical calorie restricted low fat diets, is that you lose muscle mass, but not on low carbohydrate diets if you allow the people to eat as much of fat and protein as they want and just keep their carbs low. So that would be interesting to do this study again on lipedema fat and see what happens if we allow the low carb diet group to eat as much as they want of protein and fat. This group, as any group of researchers does, they reported on what they felt that the limitations of their studies was. And I'm so glad they did this, and they put down quite a number. And one was that sample size was very small. We had 5 in the low carb diet group and 8 in the control group or the low fat diet group. And so that probably wasn't large enough groups, but it was demonstrative of what could happen. Let's study it in another larger sample size study. And then they said that the duration of the intervention, only 8 weeks, might have been too short. And that's why we didn't see a lot of major differences between the two groups for some of the other parameters that we did. So what would happen if we had it for a much longer duration? Would we have seen more differences between the groups? And then they talked about how even though both diets were similar in protein, the low carb group went ahead and they stuck to the 1,200 calories, but they ate more protein than the other group did. This goes to my thoughts of, well, maybe this, they felt like they needed something more, and they still stayed within those parameters, but this might work really well if we allow the low carb group to eat as many calories as they want, as long as they keep the distribution of those calories between, very low carbohydrate and moderate protein and high fat. So it just that group went ahead and ate fewer carbs and went ahead and ate more protein and ate a little bit extra fat. And so that would be interesting to see that. But the authors said this might be a limitation because they didn't stick exactly to what we recommended. So that could have affected the results. And then they also commented that they didn't take any data on physical activity. So that could have affected results, and it would have been great to have some kind of physical activity log or something to look at physical activity. And then bioimpedance, they actually said that this using this to look at body composition is really not the gold standard. And they recommended to use DEXA scan, a whole body DEXA scan in future studies. Maybe that would give more precise information. So that's something that we'll look at for when we do a larger sample size. And interestingly, because the authors seem to adhere to that calories in, calories out paradigm of you need to eat less and move more, and this will cause you to lose weight, they then believe that we need to have a calorie deficit. So we need to be a low energy or a low calorie diet in order for weight to be lost. Doesn't matter what the macronutrients are so much as we need to have a calorie deficit. And so because they're coming from that paradigm, they believe that we need to assess the physical activity and the body mass of each participant and then prescribe a particular calorie per day for each individual. And this is very common in the diet and nutrition world, that if you're using that paradigm of calories in, calories out, that's what you do. And so they're saying that next time, instead of saying just everybody eat 1,200 calories a day, let's see what each individual needs, depending on their body size and their level of physical activity. I'm saying that if we did a study where we just did 2 different diets and we let the low carbohydrate or carbohydrate restricted diet eat as much calories as they want, then we don't need to have a calorie deficit for that group. And then another limitation they talked about was that they had a lot of different types of lipedema in this study. Each participant had a different type. There's 5 types, as you know, and some of the types do not, the lower leg is not affected. So of those 5 participants that were in the low carbohydrate diet group, if they did not have their calf affected, then you're not going to see much change in the subcutaneous adipose tissue. So you're not going to see that going down, up, staying the same, because there's not much there to start with because they don't have lipedema there. So that could have been a limitation, but it is interesting that comparing these 5 in the low carb group to the 8 in the low fat group, the low carb group had more reduction in fat. But what if there was a bunch in the low fat group that didn't have any lipedema fat there? So that could have affected that change or that outcome. So very good, very insightful for them to look at all those different potential limitations. But I really feel like this is a wonderful secondary analysis of a great randomized controlled trial comparing 2 diets. And it really does further demonstrate the impact that carbohydrate restriction can have on not only other symptoms of lipedema, such as the pain and things like that, but it might also indicate by this study that we actually have an impact on lipedema affected fat tissue. So and this is something that's looked at often by women with lipedema, is that they're saying, okay, I can use this diet to help me with my obesity associated fat, but I don't know that it's actually going to touch my lipedema fat. And this study seems to indicate that it does, and it'd be wonderful to look at this further with a larger group with a longer duration. So I think that was a wonderful paper, and check it out. We have links for you to be able to look at that paper, but feel free to email me if you can't get the paper. And just before, and here is a comment from Kristen. Thank you, Kristen. Are both papers on lipedema simplified? If so, where? These are great. Thank you. I don't think at this time that we have a repository of papers on the website, but what a good suggestion, Kristen. And so that's something that I'm going to talk about when next I get together with everybody at Lipedema Simplified, that would be a great idea to have that. Now, I also do flash briefings that come out about once a week. And this is our little mini podcast. And I will also, this paper, as with all the papers that I've done here, I also do on that flash briefing. And so you will see a repository of them there on flash briefings. But Kristen, I think it's a brilliant idea to have a listing, and links to all the papers that I've reviewed can be on the website. So I'll definitely bring that up. Thank you for bringing that up. And looking at the people who have posted, Beck says, hi from New Zealand. Wow, I think it is quite early in the morning for you. And Cheryl is from southern Wisconsin. It's 27, but it feels like 17 sunny degrees. Yes, a little bit chilly there. But those of you are that are used to it, it feels like it's nothing, I'm sure. And Perrysburg, Ohio, 30 degrees with snow flurries. We're starting to get those, aren't we? And Laura says, yes, oh, that was Laura from Perrysburg. Thank you. So thank you guys for posting that. I have one announcement for you, well, actually a couple. One is that we have a wonderful event coming up this Sunday, December 8th. It's going to be from 9 a.m. to 3 p.m. Eastern time. It is a coaching special interest group called Love Your Body. And we're going to have some wonderful speakers, and you'll have an opportunity to interact and try techniques and explore different methods and things to help yourself. Hetty Pugh is going to be there. She's going to do guided meditation and visualization. Nina Mendelsohn is going to talk about body peace. Cindy Beers is going to be there talking about yoga and probably doing a yoga practice with you. Catherine Saya will talk about the path to emotional freedom. And Siobhan Huggins will talk about an empathic view of chronic disease and how to be more compassionate towards yourself. So that is going to be an incredible day. There is a link below. Be sure and sign up and join us for Sunday, December 8th. Oh, Sandra Gray Bagwell says 29 degrees in Western Kentucky. And, you know, it sounds like Kentucky might be further to the south and it should be warmer, but it certainly is not. I bet you have snow too. So thank you all for being here with me today. I would like to alert you, there is some great things coming up, and check out our calendar, a calendar of events. And we, as things are scheduled, we put those up on the calendar. So if you don't want to miss anything, you can go to our calendar. We'll have a link down below, our calendar of events, and you can see, for instance, this coming up on Sunday the 8th, and other events coming up. Be sure to check out that calendar so you can join us. And I see Kristen says Northern California had an earthquake 2 hours ago. Wow. And there's tsunami warnings. That's always interesting. And we've gotten, in California, we've gotten a couple of those tsunamis. They've only been about 6 inches, but you can see them. It's very interesting if you're on the coast. After you see it, if you see a tsunami come in, those little tiny ones, those can be interesting, not as fearful as people who've been through a very large tsunami. The ones we get in California have been mostly very small and interesting. But thank you all for being here with me. I'll be here again, as I say, on the first and third Thursday usually. It might be a little bit different from the holidays coming up. So, but we'll let you know. Of course, that's also on our calendar of events. Thanks for being here, and I look forward to being with you again. Bye-bye, everybody.